articulated already, that if there's any positive testing in a facility, it is the obligation, mandated obligation of the operators of that facility to let next of kin know that that's happened, Judy, and I know you've stressed that. So that'll give you some sense of some of the conversations I was on with President Clinton this morning, talking about supply chain and just getting his advice and just brainstorming about other ways we may be able to get at shortages that we continue to have. Again, we continue to be short ventilators, PPE, beds, healthcare workers, which I know Judy will talk about, our heroes at the front lines. We're trying everything we can to stay out ahead of all the above. But it, I don't have to say this when you lose 200 people, not necessarily overnight. I say that, Judy, but this is another day where that 200 includes a lot of folks who did pass yesterday and this morning, but also folks that cumulatively have passed recently. So God rest their souls. We're doing everything we can to keep the amount of folks, of lives we lose as low as possible, and separately to keep the number of folks who get this virus as low as possible. As cases continue to surge, as we expect them to do, we are adding hospital capacity, as I mentioned, as quickly as we can, and under Judy's leadership and under Pat's leadership, and alongside the U.S. Army Corps of Engineers. We're working with all of our hospitals to rapidly and significantly increase bed capacity. We are building out new wings and bringing vacated buildings back online, and we're building out our field medical stations, as I mentioned a minute ago, and expect to have our second location in Edison ready, I believe, early next week, Pat, right? 14th, okay. We're also working to expand capacity by utilizing hotels and dormitories, particularly those located in hotspot areas or in close proximity to hospitals which are nearing capacity. This is an enormous effort to bring thousands of new beds online, which also requires us to plan for medical and administrative staffing, providing wraparound services, and meeting, as I mentioned, our equipment and supply needs. At every level, this is a data-driven Moneyball process. We know where we expect our numbers to go in the coming weeks, and we have to do the difficult things to prepare for that. I will speak, I've sort of previewed this already the past couple of days, and we will speak to this in more detail on Monday. Switching gears again, earlier this week, federal authorities broke up a significant PPE hoarding situation in Brooklyn and seized hundreds of thousands of pieces of PPE, precisely the equipment that is in short supply. Yesterday, we learned from the FBI and the U.S. Attorney's Office that New Jersey will be one of the beneficiaries of the distribution of those hoarded supplies. We'll be receiving more than 70,000 N95 masks, as you can see, and 5,000 gloves, among other PPE from this seizure. I'd like to thank especially U.S. Attorney Craig Carpenito and Newark FBI Special Agent in Charge Greg Erie for their efforts in seeing that our frontline workers get this gear, and it gives me an opportunity to give a shout out to Jared Maples, who's with us, the Director of the Department of Homeland Security and Preparedness. Good to have you, Jared, with us as always. Today, Colonel Callahan will be signing an administrative order giving municipalities or counties the ability to prohibit all rentals to transient guests or seasonal tenants for the duration of this emergency, including at hotels and motels. We have heard too many stories, especially from our shore communities, of people trying to relocate for the time being into their towns from impacted areas. This is not how social distancing works. No one should be leaving their primary residences, and especially for the shore communities that do not have the infrastructure, especially the health and first responder infrastructure in place, particularly off-season, to accommodate an influx of residents. Meanwhile, we are still seeing individuals and members of our business community stepping up to help our entire family get through this. Yesterday, by example, we were contacted by Uber Eats, the food delivery service, which is donating 14,000 meals, totaling $350,000 to frontline workers at 4 hospital systems across the state. We are incredibly grateful to them, and of course, we are incredibly grateful to the heroic workers who will be receiving these meals. And of course, we are still looking for many more people to join the thousands of retired or student healthcare workers and others with previous medical experience who have already signed up to volunteer to help us on the front lines. Please visit covid19.nj.gov/volunteer. Again, covid19.nj.gov/volunteer to add your name and to have your experience matched with our emergent needs. Judy will likely address this, but it's fair to say, with all the challenges we have on ventilators where we're short, PPE where we're short, beds where we're short, in fact, in some cases, the gating factor is healthcare workers, right? Folks, because of folks who are, not surprisingly, out sick, social distancing, self-quarantining, we need all the help we can get. So please keep raising your hand and add your name to the many thousands who have come forward and say they're willing to help. If I may switch gears again to the topic of testing, tomorrow, Sunday, April 5th, the Bergen Community College testing site, we will be operating again in partnership with FEMA, will be open at 8 a.m., and that will remain open until it reaches its 500 test capacity. To be tested, you must be a New Jersey resident, and you must be showing symptoms of a respiratory illness. Please, asymptomatic folks, I don't blame you for being worried. We understand that, but you got to step aside and let the folks who are symptomatic step forward and get tested. The PNC Bank Arts Center site, which today, I'll remind you, is serving only healthcare workers and first responders, will be closed to the general public tomorrow. And please remember, these are only 2 sites which are being operated directly through the Department of Health. There are many, many other county-run and other testing sites across the state. You can find one near you by visiting covid19.nj.gov/testing. covid19.nj.gov/testing. By last count, we had at least 45 separate testing sites across the state. And by the way, the number of tests that have been completed in this state has New Jersey, with the 11th largest population in America, ranked number 4 in America, only behind New York, Florida, which have many more people than we do, and the state of Washington, where this all first evidenced itself. And if you believe you are showing symptoms, you can also take a self-assessment at covid19.nj.gov and go on the symptoms page. In any case, if you feel sick, call your primary care practitioner to see if you meet the requirements for testing. Before I close, I'd like to take a moment to once again highlight and applaud some of the folks around our state who are truly living our Jersey values by helping their community. One of them is somebody I know, Gwen Love, the executive director of Lunch Break in Red Bank in my county, Monmouth County. Gwen is keeping the doors there open to continue distributing meals and serving the needs of those across Monmouth County who need a helping hand, especially at this time. So to Gwen and her team, I say thank you. And how about this guy? This is Jim Hoffman. He's a science and technology educator at Newton High School in Sussex County, where he coaches, by the way, the robotics team. His son Justin is a resident doctor at University Hospital in Newark. Used to work for you, Judy. Jim the dad, is using both his personal 3D printer and the 2 at Newton High School to produce protective face shields for the doctors and nurses who need them. So to Jim, we cannot thank you enough. Gwen and Jim are just 2 of what we know are thousands of ordinary New Jerseyans who are doing extraordinary things to help us pull through this emergency. Whether it's by keeping a community fed or making sure our frontline healthcare workers have the gear they need to stay safe on the job, or I should note the work of the many community pharmacists, another group I want to give a big shout out to, who have kept their doors open to preserve their community's health and wellness. We have heroes up and down the state, beginning with our healthcare workers, our first responders, the community pharmacists I just mentioned, the folks who are working in essential retail, the NJ Transit bus and rail folks, the supply chain folks in warehouses, the longshoremen I mentioned yesterday. The list is incredibly impressive, and they are collectively our heroes and many more. We want to hear more stories like theirs, so please keep tweeting and using the hashtag NJThanksYou, and we'll keep sharing them. And please, everybody, please keep doing what you're doing to slow the spread and flatten the curve. That's also heroism. That's everyday heroism. And 100 years from now, when they write the memorials about what you did, that will be prominent among your life achievements, that you were there when we were needed the most. Keep up with your social distancing and keep staying indoors at home unless you absolutely need to go out or unless you are part of our frontline response in whichever way you are serving, because we need you. Keep doing the little things, washing your hands with soap and water. Keep smart. Keep remembering that we'll get through this, and we'll get through this faster and stronger if we all do our parts. And before I introduce Judy, let's just all remember again, this is war. We are in a war. How do you win wars? You don't panic, and you don't go business as usual. You win it by being smart, aggressive, proactive, shooting straight with each other, being honest about the toll that is both before us and will continue to grow. Let's not kid each other. You win wars by not turning on each other, but to the contrary, coming together, this extraordinary diverse state coming together as one family. You win a war because you work harder than the next folks. You win it because you show courage, as we're seeing every single day up and down this state. From our frontline healthcare workers to every single one of the 9 million of us, including folks right now at home by themselves doing exactly what we need them to do. Every single one of us is a hero right now. Every single one of us must do our part if we are to flatten the curve of this virus, allow our healthcare system to be able to deal with it properly, and then emerge on the other side. And unequivocally, may I say, if we all do our part, there is no question in my mind we will win this war and we will emerge from this stronger as one New Jersey family, more together than ever before. With that, please help me welcome the woman who needs no introduction, the Commissioner of the Department of Health, Judy Persichilli.
Thank you, Governor. Well, good afternoon. Yesterday, the CDC recommended the use of cloth face coverings in community settings to help reduce the spread of COVID-19. There is a growing body of evidence that asymptomatic, or what they call pre-symptomatic, individuals can actually spread the virus. So the CDC is recommending using a simple cloth face covering that covers the nose and the mouth. Cloth face coverings can be made at home from common materials like scarves or bandanas. And remember, a face covering, lowering your chances of spreading the virus to others, it is not a fail-safe measure to prevent you from getting sick. Everyone can do their part to slow the spread of this virus. If you wear a mask, you are protecting others. And if others wear masks, they are protecting you. The cloth face coverings recommended are not surgical masks. They are not medical grade N95 respirators. Those are critical supplies that must continue to be reserved for healthcare workers and other first responders who are caring for the sick. As the governor said yesterday, social distancing is by far our best preventative measure. Wearing a simple cloth face covering when you are out is not in any way a replacement for social distancing to flatten the curve. You must continue to keep at least 6 feet distance apart from others. Keep regularly washing your hands with soap and water for at least 20 seconds. Practice safe respiratory hygiene. And if you feel under the weather, even if you're convinced it's just your allergies acting up, stay indoors and away from others. I also want to return to another concern we talked about yesterday, the growing distress and fear of family members who have loved ones in long-term care settings. Family members have expressed growing concern about the lack of communication in some facilities when there is a resident who is confirmed with COVID-19. Families are frustrated that they believe they can't get someone on the phone in these facilities, and they want to know if there is an outbreak in the facility in which their loved one has residence. On March 6th, our Deputy Commissioner, Marcella Maziarz, sent a letter to all nursing homes, assisted living residences, comprehensive personal care homes, residential healthcare facilities, and dementia care homes, reminding them of their responsibility under the law to have an outbreak response plan, including clear policies for the notification of residents, families, visitors, and staff when at least one COVID-19 case has been confirmed in a resident or a staff member at the facility. Today, I will be sending a follow-up notification to all long-term care facilities with specific guidance as to how to notify people. It must be in person and in writing to all residents. In person and in writing to all staff members. Notification via telephone, email, or other method of communication the facility is using to notify the resident's family member, guardian, or designated person during this time of restricted visitation must be followed up in writing within 3 days. This morning, I also spoke, as the governor did, to the CEO of the Long-Term Care Association to inform him that we are not notified, that if we are not notified by the close of business on Monday that these directives are taking place, we will release the names of the long-term care facilities with at least one COVID-19 case. Regarding our hospitals in the northern part of the state, we predicted that we would see a surge beginning the mid-second week of April, going through the end of April and into May. However, we believe that part of that surge is just starting. Last night, we had 9 hospitals on divert, primarily due to staffing issues and critical care bed capacity. 3 hospitals were on divert for critical care. 6 on full divert, primarily due to staff issues. We need volunteers. We need volunteers to assist us in this effort. If you can volunteer, please visit covid19.nj.gov/volunteer to sign up. We are sending out today a crisis alert for more volunteers. If you can volunteer, again, please visit covid19.nj.gov/volunteer to sign up. We need you. Our hospitals are reporting over 4,000 confirmed positive COVID patients in our hospitals as of last evening, and an additional over 2,000 PUIs, or persons under investigations, awaiting test results. 1,494 of those patients of confirmed positive are in critical care, and over 85%, or 1,263, are on ventilators. Also, our first field medical station in Secaucus will open on Monday. This morning, as we speak, there is a training session being held for individuals who are volunteering to staff that site. As the governor mentioned, we are reporting 4,331 new cases for a total of 34,124 cases in the state. That will continue to grow. We need the volunteers. We need the field operation to be up and running. Again, sadly, 200 new deaths have been reported. Of the new deaths reported, 47 were from Bergen County, 37 from Essex, 21 from Ocean, 8 each from Mercer and Morris, 6 from Monmouth, 4 from Passaic, 3 from Warren, and 1 each from Burlington, Camden, Cumberland, Hunterdon, Somerset, and Sussex. 9 of these new deaths were residents of long-term care facilities. So we now have 846 fatalities in our state. We join with the governor and offer condolences to the families who have lost loved ones. The county breakdown of new cases is as follows: Atlantic, 28, Bergen, 607, Burlington, 98, Camden, 74, Cape May, 7, Cumberland, 5, Essex, 409, Gloucester, 31, Hudson, 494, Hunterdon, 23, Mercer, 89, Middlesex, 400, Monmouth, 301, Morris, 214, Ocean, 268, Passaic, 489, none in Salem, Somerset, 108, Sussex, 21, Union, 287, and Warren, 30. And we are still gathering more details on 348 of these new cases. At this point, 148 long-term care facilities in the state are reporting at least one COVID-19 case. And as the governor shared, we have 375 long-term care nursing facilities and approximately 200 assisted living facilities and other settings such as residential memory care housing. I do want to share the breakdown of the 846 reported fatalities. 61% are male, 39% are female. As far as the age range, there are 6 cases, or 1%, under the age of 30. 47 or 6% between 30 and 49. 16% or 136 between the ages of 50 and 64. 32% or 268 individuals between the ages of 65 and 79. And 46%, 389 over the age of 80. We have documented underlying health conditions for 300 of our cases at this point, or 35%. We have 4 cases identified as not having an underlying health condition. Only 4. Otherwise, we have 542 still under investigation, so we expect those with underlying health conditions to increase. And again, about 9% associated with long-term care. So you may not feel sick, but it is possible that you could transmit COVID-19 to someone more vulnerable. We ask you to be careful. We ask you to follow the CDC guidelines when you leave your residence. For more information, I encourage you to call NJ211 or visit covid19.nj.gov. They're great resources for the public to get information. Thank you.
Thank you, Judy, for that and for all. A couple of points, if I may follow up, Judy, with you. Again, top 5 counties are staying about the same in terms of positive cases. I'll just read them in order. Bergen continue, number 1. Essex, number 2. Hudson, 3. Union, 4. Passaic, 5. So it's that same cluster of the Northeast counties. Again, Judy, cloth face covering is the recommendation from the CDC. And to dovetail that with, and by the way, that's something that I'll speak for all of us that we'll all take seriously. It's hard to do a press conference with a face mask or a face covering, and we're staying 6 feet apart, and we will make sure of that. But that's advice that we're not only giving to people via the CDC, but we'll take their advice ourselves. But importantly, cloth face covering is not a face mask necessarily, and certainly it isn't a surgical or an N95. And I would just beg people, do not, I'm begging you, don't go out and have a run on the very masks that our healthcare workers, first responders, and by the way, they don't even have enough, never mind expanding it out to the other categories of folks that we want to expand it to, essential, retail, NJ Transit, et cetera, et cetera. Did I get that right? So again, please don't compound a challenge that we already have bear with me. The notification on long-term care facilities, I just want to repeat, we mean business on that, right? If the facilities don't do the proper communication by Monday, we will communicate directly to you in this forum or in some other forum ourselves. Is that fair to say? So we mean business on that front. Cannot say that enough on volunteers. Please go to the main website, covid19.nj.gov/volunteer, because goodness knows we need you. And I saw a great picture of the very group of volunteers today in Secaucus going through their training, and it was really heartening to see. That's going to really be up, modest at first, but it's going to be up and open for business on Monday. It's an extraordinary feat in terms of getting it up and running and now getting it staffed, and very soon, within a couple of days, being able to handle patients. So hats off, and obviously Edison and Atlantic City not too far behind. Before we hear from Rob, anything, Pat, on the compliance, PPE, bed construction, or other topics?
Just thank you, Governor. Just one correction. I had Atlantic City and Edison confused. The Edison Field Medical Station is almost, is about 75% complete. That should be ready by April 8th, not the 14th. It is the Atlantic City Convention Center that the target date is April 14th. I just wanted to clarify
So that's Secaucus open for patients on Monday, again slowly but surely. On Wednesday, Edison likely to be in the shape that you and I saw Secaucus as of last Thursday.
Yes, sir.
And then it will be a week from Tuesday for Atlantic City.
That's correct.
Perfect.
As far as the overnight, really generally quiet. There was a subject charged with the executive order violation for facilitating and pulling together a youth basketball game with 6 juveniles. He was cited. There was a subject arrested for domestic violence and brought to the Monmouth County Jail in Freehold, where during his processing, he claimed to have the coronavirus and spit on the officers trying to process him. And once again, Newark last night issued 122 summonses and closed 7 businesses. I did speak with Director Ambrose this morning to thank him for his continued efforts and to offer our condolences on the loss of Officer Tolbert Furr, who did pass away as a result of COVID-19. Thank you, Governor.
God rest his soul, and all the others whose lives are lost. The knucklehead hall of shame just astounds me that somebody would do what that guy did in Monmouth. So, again, folks, the great news is overwhelmingly everybody in New Jersey is doing exactly what we need you to do. But we need everybody to do that. And so please, no gatherings, no stupid behavior certainly, but please, everybody, stay at home. So clearly this is a time of hurt for so many. Look at the lives lost, the precious souls, their families and friends and communities, the folks who are dealing with COVID-19 right now as we speak. But let's also remember at the top of the list is a historic amount of people who have lost their jobs in this state and in this country at levels that are literally, Rob, I said yesterday, tens of times more than any normal period, and even relative to other spikes in our past. And I know there's a lot of folks out there who are clamoring, and who could blame you, to get that security of having the connection made, whether it's online, whether it's on the telephone, that you know you're going to get the unemployment insurance. And the great news coming out of the bill that was signed by the president a week ago yesterday, there's now more federal help, and that's a big deal. And I've said before, and I'll say it again as I introduce Rob, everybody please bear with us. They've got some extraordinary folks led by this guy and his team are doing everything they can to answer your calls and to respond and to make sure you get that comfort you need. Just know that it's an unprecedented level, and you won't lose one penny of support if it takes a little bit longer, I promise you that. So with that, the leader of an extraordinary group of folks who are doing everything they can, please help me welcome the Commissioner of the Department of Labor and Workforce Development, Rob Acero-Angelo.
Thank you, Governor, for having me this afternoon, and thank you for the shout out to James Hoffman and the Newton Robotics team. I've seen Aperture perform a couple times, and they are no joke. Judy, Pat, thank you so much for your strong and stable leadership during these times. I really appreciate it as your colleague and New Jersey resident. Over the prior 2 weeks, we saw more than 362,000 people apply for unemployment as a result of this public health emergency. The crush of layoffs and furloughs have overwhelmed state unemployment agencies nationwide, and New Jersey is no exception. We are seeing volume of claims to our website and calls to our customer service centers exponentially higher than at any time in history. I don't like correcting the boss who said we had 10 times increase in claims, but the first week of the crisis, we saw a 1,600% increase in volume, 1,600% in a single week. But I'm not here to talk about the strain our system has been under the last few weeks. I'm here to talk about what's really important, our action plan to serve the public at this difficult time. There's nothing I want more than to put your hard-earned benefits into your family budget sooner. We've made no secret about the inflexibilities of our legacy technology and our desperate desire to receive and act on more of your phone calls. We hear your frustration, and we are with you. We're currently working to bring into our systems more of your calls and emails. This is our #1 priority. We hear it from our own family members, friends of friends, all making similar pleas for help, as this pandemic has impacted everyone. As one New Jersey family, we've been affected together, and I'm confident we will get through this together. I want to thank my colleague, Chris Ryan, at the Office of Information Technology, and our own IT staff, led by Sharon Pagano, who have been working nonstop to make our 40-year-old mainframe systems continue to perform under such atypical circumstances, and all of our UI division, led by Greg Castellani, who have become economic first responders for much of our state. We are moving aggressively. Here's what we have done and what we are doing to better serve our customers. We're increasing capacity to ensure more calls and more applications get through at one time. In recent years, we've incorporated pocket solutions and changes to our unemployment systems that have allowed 92% of claims to come in online, taking stress off of our phone lines. By comparison, after Superstorm Sandy, peak of online filing was just 70%. When you're talking about the numbers we're talking about, that's a big difference. We're pinpointing places where claims are getting stuck and using all the department's resources to reroute those claims so we can pay them as soon as possible. We're adding phone lines and have trained employees from other divisions to help us field calls. We have procured hundreds of additional laptops so more staff can work remotely. We're continuously updating our website, adding information in easy, plain language to walk our customers through the application process. We know this is new for a lot of people, so we're trying to make our clunky, old applications as user-friendly as possible. nj.gov/labor and myunemployment.nj.gov provide great resources for first-time filers, including FAQs. We have put out helpful guides so our customers can feel secure they're applying for the right program, which also speeds their processing. We're working to make sure our customers have the information they need from us to understand what is happening every step of the way, so they won't have to worry about their benefit application, their benefit amount, or waste time trying to get through on the phone. We have our staff working overtime, late hours, and on weekends to move claims along that need an agent's review. The number of new unemployment claims moving through without issue is about 50%, which is no different than before the pandemic. That means half the residents who file for unemployment begin receiving benefits within 2 or 3 weeks. When filing online, there are reasons a claim might not be processed immediately and need one of our claims examiners to review it. A person may be filing for the first time and did not provide all the required information or already had an old account in the system. A person may be temporarily furloughed, so they may feel confused about the federally mandated work search questions on the unemployment application, or they are independent contractors who have been told to apply while we await federal guidelines on how to administer benefits to this unique population. These are not uncommon issues for our staff, but they do require verifying important information and walking through the process with claimants one at a time. Imagine a stadium with 10,000 seats, but there are 1 million people waiting to get in. There are only so many who can get through the gates at one time. To help reduce the number of claims that do need agent intervention, just last night, maybe it was early this morning, we posted a brand new FAQ with 45 additional COVID-specific filing questions. I can't stress enough how much we empathize with the frustration, fear, and economic uncertainty that comes with suddenly being unemployed. Due to the high volume of claims being filed, there may be a delay in processing the backdate, but they will be paid for each week they are eligible for benefits, no matter when the claim gets processed. We also suggest applying online during off hours, such as first thing in the morning or later in the evening when traffic is lightest. We recognize this is small consolation when the bills are due today, but we are working on getting you help as fast as we can. This is why we're also grateful for the additional support the federal government and the NJEDA are providing to businesses in the forms of grants, loans, and payroll tax credits for keeping employees on the payroll that my colleague Tim Sullivan talked about here yesterday. The Federal CARES Act, the governor mentioned, signed last Friday night, will bring direct relief to our workers by expanding unemployment eligibility and providing an additional $600 per week for 4 months, on top of what state programs pay. And it also will open up benefits to those who are not traditionally eligible, such as the self-employed and independent contractors. However, we still have to wait for federal guidance before this can begin, but relief is coming. This week, that ends today, is the first week claimants are eligible for this additional $600 benefit, and New Jersey residents will receive this just a few days after they receive their regular unemployment check next week. They do not have to do anything else to get this additional funding. We are awaiting guidance from the U.S. Department of Labor on how and when to administer the 13-week extension of unemployment benefits known as Pandemic Emergency Unemployment Compensation, but we will share this information far and wide as soon as we have it. In closing, I want everybody watching to know that our department is working harder than ever before to address the hardships many of you are facing due to this pandemic. Our staff is in our office or at home working remotely right now because this is the biggest emergency our department has ever and hopefully will ever face. I join in the governor's sentiments that together we'll not only beat this unprecedented threat to our health and welfare, but we will emerge on the other side a stronger and more united New Jersey. Our workers and businesses have paid into this system precisely for this moment, and now it's here for you. We will get every one of you, our fellow New Jerseyans, the help they deserve. Thank you, Governor.
Rob, thank you, and thank you for your leadership every day, but certainly these days. You know, Rob has got deep, first of all, he's an organized labor family guy. Secondly, he has deep state experience. Clearly, he's leading our efforts, but also had federal experience under Secretary Perez in the Obama administration. And for all those reasons, we're incredibly honored and glad to have you at the helm, particularly during this crisis. This will be of no solace to somebody who's trying to get through, and I'm not intending it to be any solace. But as we look at other states and compare notes, which we do all the time, I'd say we're in a meaningfully, again, not going to make you feel any better, we're in a better position than most of the folks that we're talking to. So we're all in this together. The numbers are ginormous relative to anything we've ever dealt with historically, and certainly relative to any norm. And secondly, in our list of volunteers, Judy, not only do we need healthcare workers, but given the legacy systems, we should add a page for COBOL computer skills, because that's what we're dealing with in these legacies. Chris Ryan's doing a heck of a job, but literally we have systems that are 40 plus years old, and there'll be lots of postmortems, and one of them on our list will be how the heck did we get here when we literally needed COBOL programmers. So thank you, Rob, and thanks to each and every one. We're going to start over here. We're going to try to go at a pretty good pace today. Brett, we'll start with you. Good afternoon.
Yes, good afternoon. So,
Brendan's got the microphone. That's Brendan. He's with you.
Oh, no problem. Hi, Brendan. Colonel, do you have any more information on where that basketball game was? And it was 6 people who were juveniles?
I'm sorry, that was in Raritan Township. It was a
Hunterdon County?
Yes, and it was just again a gentleman organizing a game of 6